Welcome to the Business Edge with Central Willamette. I'm here with Eric, our senior manager here at the marketing department, as well as we're welcoming back a really good friend of ours, Andy Shelley. He is the co-owner and founder and CEO of CannXperts, one of the most trusted names in the cannabis industry here in Oregon and in actually several states. Andy's been on the show before, and we always appreciate his insights and stories. We've got a ton to talk about today, so let's just get to it.
Yeah, thanks for joining us today, Andy. I really appreciate you coming out.
You bet. Glad to be here.
Yeah, how's the new year been treating you so far?
So far, so good.
You said you just got back from a Mexico trip, you said?
Oh, boy.
I'm going to rub it into everybody who's listening, including myself. I'm just a little bit jealous of that. So I just want to let you know I'm not over that yet. So
Yeah, it was nice.
Yeah.
Me and some of the team went down there for 10 days. So.
Oh, that's nice. You brought some of the team, you said?
Yeah, well, they work really hard. So
you, as a company, brought your team members down
couple,
there?
yeah.
That's freaking awesome.
Yeah.
We should celebrate that for sure then. That's really cool. We should get them on here and have them brag about it.
Yeah,
about how
please
cool their
do.
boss is and brings them on trips to Mexico. I just need to fill out my W-2 and get myself a trip to Mexico with CannXperts
You're
next year.
in. Both of you. Let's
Yes,
go.
Exactly. We'll do a remote podcast from there. But yeah, let's jump into it. I kind of want to jump in and have you back on because there's been some changes with this administration on rescheduling of cannabis. Went from Schedule 1 to Schedule 3. And I don't really know what that means, so I wanted to bring an expert and kind of get a little bit of history on that and a little bit of education on that and try to share that with our members.
Sure. Is that where we're starting?
Yeah, so I guess, kind of tell me, what does that even mean? Have you heard the term Eli 5? Explain like I'm 5? Yeah, so make it as easy as possible for me to understand. But, what's the big gist, the big changes that people can expect from Schedule 1 to Schedule 3?
Well, a lot, and I don't think anybody really knows exactly what's going to happen. It is still Schedule 1 today. Schedule 1 is like heroin and those drugs that the government identified as being easily abused and easily you become addicted to. So it's been in that for the last 26 years.
And correct me if I'm wrong, also with part of Schedule 1 is it can't have any medical purposes, correct?
That's
There's no
correct.
identified medical whatever, because there are some treatments that are addictive, but they actually have medical healing or medical properties.
Sure.
Right?
And that's kind of where you get into Schedule 3, which identifies that there could be or there are some medical treatments but still heavily controlled in that, the codeines and stuff like that it needs to be prescribed and you got to go to a pharmacy to get it.
So is that essentially what they're admitting is previously they looked at cannabis as no medical treatments, and now they're saying that there are some?
Yeah, potentially. Biden, during the Biden era, they sent it over to the HHS, Health and Human Services, to give their recommendation on where it should be, and they came back and said Schedule 3, and based on everything that they knew about it. And then it kind of sat for a while, and that was the first. Everybody's hurrahing over it, but it didn't really move after that. So until last month or back in December, and President Trump sent it over to he did an executive order to the Attorney General, the Department of Justice, to start making rules around Schedule 3.
Oh, got it. So, because I did hear about the rescheduling. The rescheduling was done by, what was that department they said? The Health and Services?
Yes.
Yeah, so they rescheduled it, but nothing was done yet until there wasn't. Okay, that's the part I was kind of confused on as well.
Now they go into this, how are we going to create these rules around this, the whole thing, and it's kind of a mess. I honestly, the big talk was that something would change this year, and I don't have a crystal ball. I wish I did. When it comes to the government doing things, I think it typically takes a lot longer than you think.
Especially with the shutdowns that have been happening. I heard things move a little slower during that time.
Sure.
So. So at this point, it's still there's an executive order out, but they're making the rules, so there's no timeline on when it will actually be classified legally.
Yeah, rescheduled. It's still Schedule 1. Nothing's happened yet.
Okay, that makes sense. Okay, cool. Well, thanks for clarifying that. Again, I was a little confused on it. I didn't really quite know what it meant, or I guess the status of it. I just heard things, and I was like, let's get the expert in and have him explain it to me instead of looking it up on the interwebs, which I probably could have easily done. But thank you for joining us and telling us about it.
Sure.
So with that being said, what is the general vibe in the industry right now as we start the new year? Are there any new compliance challenges or opportunities the cannabis business should be aware of in 2026?
Locally, we're seeing a lot of inventory audits, which are big. I think I mentioned that last time. It's still a huge thing, especially for processors. As far as Schedule 1, Schedule 3, I think a lot of people, were hooping and hollering. This is great. And in some cases it is. It's more of a kind of a signal to the rest of the world that the government is like moving in a direction now finally after, like I said, 26 years of not doing anything. However, it fixes the list of things that it fixes and the list of things that now become problematic are, the fixes are very small and the other list is huge.
Oh, yeah, there's always got to be some bunch of crossing the T's and dotting the I's, so to speak, and actually figuring out where to put all that stuff. So.
Yeah, I mean, it immediately, Schedule 3 releases that 280E tax code, whatever it is, where people can't write off normal business expenses. So Schedule 1 and Schedule 2, you can't do that. Schedule 3, you can. Like I said, it shows investors and lenders and stuff that we're closer and you can probably do more underwriting. However, you're also in so many ways you're inviting the fox into the hen house at this point, because now you're going to have the federal government involved with these businesses that have, largely they've just been untouched this entire time. So
all state regulated, no Fed, really, right?
Yeah, this is going to be a whole new thing.
Because now we got to find out what their role in this whole thing is, right?
Yeah, and they will have a role, and it doesn't fix interstate commerce. It doesn't fix banking.
Why would it?
It doesn't fix It's not. It doesn't make it federally legal. It's still federally illegal, even in Schedule 3. So, none of that gets fixed.
Yeah. Just so everyone kind of get a little backstory on that 280E, 280E, correct?
Mm-hmm.
Yeah. So all cannabis companies are looked at not as businesses, so they are taxed on the gross dollar that comes in. They're not able to write off any of their expenses for employees, any of their cost of business, basically. So every dollar that comes in, they pay the federal government right away, and then they pay all their employees and pay all their other taxes, and then whatever's left over, that's what's done. With the 280E form, they use that apparently to go after drug runners, drug smugglers, to kind of see how much tax revenue they've avoided, to go after them that way. But now that tax code is what they use in businesses, and now they're with the Schedule 3, they're actually able to be seen as a business and probably get some write-offs, correct?
Yeah, they'll be able to write off what other businesses just like mine, what we write off. Some businesses in the industry, especially retailers, they may be paying 70% in tax by the end of the year.
That's insane. Like, that's the big thing too, is people are always like, oh, these cannabis industries are millions of dollars, but no one can keep the businesses open. I was like, well, if it's 70% tax rate, it's kind of hard to do really anything at that point. But just to give you guys a heads up on that, that's exactly what Schedule 3 is going to be. Probably the first thing that resolves issues for them is gives them a new tax code, and then a whole host of other issues come up. But again, it just, I feel like it's a green light. We've all been sitting at this intersection waiting for a light to turn green to know what direction we can go, or to even make a decision on what direction to go, but we've been stuck here. So now that green light, we still got to decide, apparently we still got to put regulations in place for interstate commerce, and then making it legal across the nation, right? That's like the next steps, basically.
Yeah. If the FDA were to approve it, it could open up interstate commerce. There's actually a lawsuit against here in Oregon right now that's a fight over interstate commerce. So we'll have to see how that goes. I got the motion on my desk today. They're motioning to dismiss, the state is. But I think they have a pretty good argument, and the attorney involved with that's pretty smart guy, so competent.
I always thought it'd be great if they just did the I-5 corridor, called it the Canada corridor, because I mean it's legal up and down. I think right from California all the way up to Alaska. I mean everything across that I-5 is going to be legal, so it'd be a nice little place to start it. But that's just me.
Yeah, but you know the problem there is you're talking about 3 states that are already overproducing. And
very true. Yeah, where we want to actually be able to move it into. You're right. That makes sense. We need to add Nevada into that to throw some.
But that will be key at some point in the future because we can produce so much, and other, especially like northern states or other plain states, and southern states, it's hard to grow outdoors in the quantity that the United States will need or international. So I'm hopeful because Oregon is in a perfect spot to produce for a lot of places.
Yeah, that totally makes sense.
Yeah.
Do you think this move will finally make it easier for cannabis business to work with banks and credit unions?
You know, I don't think it really does anything for banks at this point. You know, we would need that Safer Act passed in Congress. I don't think anything is going to change for you all. I mean, there's still going to be cannabis related businesses. You're going to have to do all your due diligence, all the things that you're doing now. It really doesn't affect that at all.
It totally makes sense. Actually, with one thing with Schedule 3, might be last answer this for me, is if it's not Schedule 3, you can't get you can't get funding to do medical science on it. But if it's Schedule 3, now you can actually crowdsource or crowdfund for to do medical research on cannabis. Is that correct?
Yeah, absolutely. So that's another bonus, is that it does open it up to actually do the research that they all want to see. So
that's awesome, because I mean, for people out there who don't know, every person has an endocannabinoid system, and that's what interacts with the cannabis plant. And how that actually how those cannabinoids interact with your system is still unknown. We do know it does obviously interact with it, but how does that happen? It'd be nice to actually get some funding to figure that out.
Yeah.
Forward.
Yeah, sure.
What about investment? And it does open the space up for that, for like people or make it easier? Do you think it will anyway? Or now that it's Schedule 3, do you think you're going to start seeing a lot more influx of people looking to invest?
I think so. Maybe not in the areas that everybody wants it to, but it's not Schedule 3 yet. But when it goes there, I think it helps people to feel a little bit better about investing. But we've already seen what's happening now is brand new pharmaceutical companies are popping up. There's at least or around 100 of them, is what I've heard. Since the rescheduling has been talked about. And these companies are positioning themselves to do the testing, to create new products. And so that's going to probably change the nature of the game.
Probably synthesize things too, most likely, right? Find ways to like the synthetic version of THC or whatever.
Yeah, which has been dispensed for a long time now.
Yeah, I think that's kind of when pharmaceuticals get involved, that's the first thing they do is find a way to homogenize it.
Yeah, and in my position, I'm looking at like who's going to benefit from this, and then how can we get our people, positioned to benefit from it.
I think once they find out what cannabinoids do what, I think that's going to be phenomenal, because there's CBG, CBN, CB, all these different CBD, whatever, but we don't quite know how they interact with the body or even how to, which plants produce those. But once they're able to kind of synthesize that and then actually have that and be like, this does this, I think that'd be kind of cool to see once they get the science behind that.
Yeah, and that's what these new pharmaceutical companies are exactly what they're working on, is extracting each cannabinoid, and they're going to create products off of that.
Yeah, and I hope they also take the time to do the synergistic effect with the terpenes and cannabinoids and which ones, because there's just so much. I mean, you don't know how many cannabinoids are in there, how many terpenes are in here. I don't. And like, how do they actually interact with each other? Because which receptors did they bound to, and like, do they interact when one goes to CB1, one goes to CB2? Like, how does that interact? Like, I just hope they really get involved in that and not just focus on singular compounds.
Well, I guess we'll have to wait and see.
I know, sorry, got a little geeked out there a little bit. Sorry. Anyway, so what are you excited about or nervous for this next year with the cannabis industry?
Like I said, I don't know what's going to change this year. I think that's a good thing. When you start talking about the feds getting involved, you're talking about certifications or interstate commerce. You're talking about certifications that our people currently don't have. So that gives them a little bit of time to start focusing on the next phase of this whole thing. And I've talked to some people, and it really doesn't matter if your end game is to sell your company for the most money, or your end game is to be in it for the long run and be a supplier, or however this thing's going to shake out. I'd be looking at maybe supplying to larger companies, and in order to do that, you're going to have all sorts of good manufacturing practices, OSHA certifications, EPA certifications, all the things that the major companies that are out there now are looking for in a partner, and also looking for if they're going to buy your company for the highest price. So, we're setting those things up and the tracking of all that software and everything in order to get our clients into that position.
Oh, totally makes sense. Yeah. Got to prep for the future.
Yeah. I mean, it's been, as you know, our industry, it's been kind of ad hoc really for the last 10, 12 years, and that's not a bad thing.
No.
Typically when you create a company, mine's not excluded. You're kind of building the car while you drive it. Now's the time to really get your manufacturing practices or your growing practices down and documented and repeatable.
That totally makes sense. I mean, the whole last decade, it seems like people just been flying by the seat of their pants, whatever comes up. And they're just, and so this, again, like you said, no one's really had that sense of calm or that sense of things are getting finally ironed out. And this is kind of the next step to let people start thinking about that.
Yeah. Hopefully they take, what's happening with the rescheduling to really start working on that stuff, or reach out to us and we can get them going on it.
That'd be awesome. Michelle, do you have any questions or anything? Sorry, kind of ordered this whole conversation.
No, I enjoy listening to you guys. It sounds like the best course is to kind of refine your practices, get into the best position, come up with your own best practices, and be in line.
Finally work on those things that you said you would someday do.
Yeah.
Today is that someday.
I can't stress it enough, because these certifications are lengthy. To be GMP compliant takes a year, and that's going through everything you're doing and getting your practices nice and lean, documented, repeatable. These large companies want to see error rates of less than 2% in your products. We just don't have that right now.
Yeah. Nowhere near sophisticated enough for that.
They're willing to spend the money, but they want to see this repeatable, low error rate time after time after time.
Totally makes sense.
Yeah. Yes, consistency. So, it's going to be huge. So, and we're looking at maybe this year, maybe next year. So there's not a lot of time left.
Yeah, I got to jump on it sooner than later. Yeah. Oh, anything else on your radar that you think people should be paying attention to?
Oh boy, you threw one at me. No, just those things that I mentioned. I really don't want to see, the smaller operator. There's going to be constriction in the market again. The big guys are going to be buying out the small guys, and that's what's going to happen. And the biggest guys we have are, the pharmaceutical companies and maybe alcohol. And they've already started positioning themselves in different ways. So
totally makes sense.
Just be ready for that. I hated seeing, over the last 10 years I've been doing this, some of my friends going out of business, and just try to position yourself to be, shine up the car and vacuum it out before you sell it. You'll get a lot more money for it. So.
Totally understandable. Well, anything else you want to share before we finish up and wrap up here? Or?
Just, I'm always available. So if anybody needs any questions answered, reach out, CannXperts.com. Our phone number is, I have to bring it all the time because I forget, 541-241-6940. We're operating mainly in Oregon. We do have clients in Ohio, and we are we do have a spot in Texas already, even though it's not legal there yet. But there's so much going on there that we do have an employee down there.
Getting ready for it.
Yeah.
And you also can find their information on our website at Central Limit. Sorry. I already forgot ours too.
Want me to write it down for you?
CentralWCU.org. Yeah, sorry. We have a link for them as well, so on our page.
Well, that's going to wrap up this episode of The Business Edge with Central Willamette. Andy, as always, thank you so much for your time and for joining us today. We really appreciate your perspective and all the insight you give us every time. And thanks to everyone who is listening. If you enjoyed this episode, be sure to subscribe and check out our past conversations with Andy and other industry leaders. If you have any questions or topics you want us to cover, please let us know. We love hearing from you. And now, as always, you can learn more about this podcast and Central Willamette Credit Union at centralwcu.org. Thanks again for listening to The Business Edge.
Thanks, everybody.
The information provided here is for informational purposes only and does not constitute financial advice. Consult with a qualified financial advisor before making any financial decisions.